A resident with dementia repeatedly insists they need to go to work. What is the best response? A. Tell them they are retired and no longer work. B. Ignore the comment and walk away. C. Engage them in conversation about their former job. D. Argue until they accept the truth. Answer: C. Redirecting and validating feelings helps reduce anxiety. Discussing their past work provides comfort without confrontation. Which of the following is the most effective approach when providing personal care to a confused resident? A. Give multiple instructions at once. B. Explain each step one at a time. C. Avoid explaining anything to prevent confusion. D. Speak loudly to gain attention. Answer: B. Step-by-step directions prevent overwhelming the resident and improve cooperation. When a cognitively impaired resident becomes agitated during bathing, what should the CNA do first? A. Stop the bath and try again later. B. Restrain the resident for safety. C. Continue regardless of their behavior. D. Scold the resident for non-cooperation. Answer: A. Agitation may signal fear or discomfort. Pausing the activity and attempting later maintains dignity and trust. A resident keeps wandering into other residents' rooms. What should the CNA do? A. Scold them for invading privacy. B. Physically block them from entering rooms. C. Redirect them to a supervised activity. D. Lock their room door. Answer: C. Redirection prevents conflict and maintains safety without punishment. When a resident with Alzheimer's disease becomes upset about not seeing their deceased spouse, the CNA should: A. Remind them the spouse has died. B. Change the subject gently. C. Laugh to ease tension. D. Leave them alone to calm down. Answer: B. Reality orientation may cause distress. Distraction helps shift focus to a positive topic. The CNA notices a resident with dementia has stopped eating. What is the best first step? A. Report it to the nurse immediately. B. Offer finger foods and observe. C. Remove their meal tray. D. Assume they aren't hungry. Answer: B. Loss of coordination may hinder eating. Finger foods promote independence before escalation to nurse reporting. What is the primary goal when caring for residents with cognitive impairment? A. Correct their memory problems. B. Enforce strict routines. C. Increase medication dosage. D. Maintain their safety and dignity. Answer: D. Preserving dignity and safety supports quality of life despite cognitive decline. Which technique helps a resident recognize familiar surroundings? A. Frequent room changes. B. Personalized decorations. C. Removing photos and objects. D. Keeping lights off. Answer: B. Familiar items reduce confusion and promote a sense of belonging. A confused resident refuses medication. The CNA should: A. Insist firmly until they take it. B. Discard it quietly. C. Crush and hide the medication. D. Document refusal and notify the nurse. Answer: D. Medication refusal must be reported, never forced or hidden. Which sign indicates sundowning in a resident? A. Confusion that improves in the evening. B. Increased confusion and agitation at dusk. C. Sleeping during the day. D. Aggression after meals. Answer: B. Sundowning involves late-day confusion due to disrupted circadian rhythms. A resident with dementia believes staff members are stealing. The CNA should A. Argue and prove innocence. B. Ignore the accusation. C. Search their belongings. D. Calmly reassure and redirect. Answer D. Reassurance and distraction reduce paranoia without confrontation. During mealtime, how should the CNA assist a resident who forgets to chew? A. Place food in their mouth. B. Gently remind and demonstrate. C. Scold for improper eating. D. Stop feeding entirely. Answer B. Demonstration encourages memory recall through visual cues. When a resident with memory loss repeats the same question, the CNA should A. Answer patiently each time. B. Tell them to stop asking. C. Walk away silently. D. Yell to gain attention. Answer A. Repetition stems from anxiety. Patience maintains emotional stability. A resident becomes fearful when approached suddenly. What should the CNA do? A. Approach from the front and identify themselves. B. Touch their shoulder immediately. C. Speak from behind. D. Move quickly to finish care. Answer A. Residents may not recognize voices. Approaching from the front prevents startling reactions. Which of the following can reduce agitation in dementia residents? A. Turning off lights. B. Changing their routine daily. C. Playing familiar music. D. Limiting social contact. Answer C. Familiar sounds evoke positive emotions and calm behavior. The CNA must document unusual behavior in a dementia resident because A. It helps identify health changes early. B. It is optional if behavior is normal. C. It replaces nurse observation. D. It avoids family communication. Answer A. Behavioral changes often signal underlying medical or emotional issues. When communicating with a cognitively impaired resident, which method is best? A. Repetition of long instructions. B. Complex explanations. C. Short, simple phrases. D. Fast speech to save time. Answer C. Simple language improves comprehension and response accuracy. If a resident with dementia begins to cry suddenly, the CNA should first A. Ask gently what is wrong. B. Leave the room immediately. C. Tell them to stop crying. D. Turn on loud music. Answer A. Emotional distress requires gentle inquiry and reassurance. When helping a resident dress, the CNA should A. Choose any clothing available. B. Offer limited appropriate choices. C. Dress them without input. D. Ask them to select from all items. Answer B. Limited options support autonomy without causing decision confusion. How can the CNA best support cognitive stimulation? A. Using memory games and conversation. B. Keeping residents isolated. C. Ignoring questions. D. Limiting activities. Answer A. Mental exercises preserve cognitive function and engagement. The CNA notices a resident is awake all night and tired all day. This could indicate A. Reversed sleep-wake cycle. B. Increased alertness. C. Proper rest. D. Improved cognition. Answer A. Altered circadian rhythm is common in dementia and affects care planning. Which response is most appropriate if a resident hallucinates? A. Agree with the hallucination. B. Reassure and distract them. C. Insist the vision is not real. D. Laugh at their comment. Answer B. Gentle reassurance eases fear while avoiding argument. A cognitively impaired resident suddenly stops talking. The CNA should A. Assume it's normal. B. Report it to the nurse immediately. C. Ignore the change. D. Ask family to intervene. Answer B. Sudden communication changes can indicate stroke or medical issues. A resident forgets how to use utensils. The CNA should A. Offer finger foods. B. Refuse to assist. C. Leave them alone. D. Scold for poor manners. Answer A. Finger foods encourage independence when motor memory declines. How should the CNA address a resident showing frustration during grooming? A. Ignore their emotions. B. Finish quickly. C. Provide reassurance and take breaks. D. Stop grooming permanently. Answer C. Patience and pacing care build trust and reduce stress. A resident with dementia begins wandering at night. What's the safest intervention? A. Install motion alarms. B. Lock their door. C. Leave them unsupervised. D. Use restraints. Answer A. Motion alarms allow safe monitoring without restricting movement. What should a CNA do if a resident becomes aggressive? A. Grab their hands. B. Argue back. C. Stay calm and maintain distance. D. Yell for compliance. Answer C. Maintaining calm prevents escalation and ensures safety. Which approach reduces confusion during toileting? A. Maintain consistent bathroom routines. B. Vary the schedule. C. Rush the process. D. Avoid reminders. Answer A. Predictable routines strengthen memory and confidence. A resident frequently hides objects. The CNA should A. Search their room without telling. B. Scold them. C. Help locate and return items calmly. D. Ignore missing items. Answer C. Hidden objects provide comfort, assisting them respectfully preserves dignity. When providing end-of-day care to a confused resident, the CNA should A. Use dim lighting and calm voice. B. Use bright lights. C. Hurry to complete tasks. D. Leave TV on loud. Answer A. Soothing environments prevent sundowning and reduce nighttime agitation.